Come again.
Hello, and welcome to the American Massage Conference pre-conference broadcast series on Massage Therapy Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing at the American Massage Conference, which is being held in May the 20th through 22nd, 2011, in beautiful Atlanta, Georgia. Our special guest today is Whitney Lowe. Today, Whitney and I will be talking about his topic for the American Massage Conference, active engagement techniques. But first, let me tell you a little about Whitney. Whitney Lowe is a recognized authority on pain and injury treatment with massage therapy. His contributions to the massage field are wide-ranging and include professional publications, teaching, clinical work, consulting, and participation in national boards and committees. He is the author of the books Orthopedic Assessment in Massage Therapy and Orthopedic Massage Theory and Technique, which are used in training programs and schools nationally and internationally. Whitney has also been a contributing author to several books. In 1994, he founded the Orthopedic Massage Education and Research Institute, also known as OMARI, to provide massage therapists the advanced education they would need for treating orthopedic soft tissue disorders. He is currently a member of the editorial advisory board of the Journal of Massage and Movement, the Board of Journal of Bodywork and Movement Therapies, and has been a regular featured author in publications such as Massage and Bodywork, Massage Magazine, Massage Today, and the Journal of Soft Tissue Manipulation. He also produces one of the profession's most innovative online continuing education programs in orthopedic massage. Whitney, welcome to the American Massage Conference pre-conference broadcast series. It's wonderful to have the opportunity to meet with you and talk to you today about your class, Active Engagement Techniques.
Well, thank you very much, Felicia. It's great to be here, great to be a part of this, the wonderful first American Massage Conference, as well as this pre-conference broadcast series.
Well, we are very glad to have you here. And before we get into your topic, I would like to ask you, what made you want to be a part of the American Massage Conference in Atlanta?
Well, clearly I think without a doubt it's the group that's putting it on. I've been working with Scott and Eric and the group that's done this at the Canadian conference for a number of years, and they've done an exceptional job with every program that they've put together. So when I heard they were going to be doing this conference here in the United States, I really wanted to be a part of it, and it's wonderful and exciting to work with people who are doing great work like they are, and this is a new event for our country, so it's kind of exciting to be a part of this new event and the initial launch with it here. And I would say, like everyone else, I want to come to this conference to meet new people and learn interesting things too, because it's always the kind of thing that happens at a conference like this. So especially with the energy that will be around this particular conference, I think there'll be a lot of excitement and a lot of great new connections made.
Well, I definitely agree with you, and I've heard the same thing echoed by other presenters that I've had the chance to interview, both working with the people that are involved in this conference. Scott, of course, and his team is a great experience. All of us that have been a part of that know what's coming and are excited to be a part of it, but also for the chance to network and to meet new people and to improve our own education. Even though we might be the quote-unquote experts in the field, it's always great to learn what other people are sharing and talking about and bringing to the industry.
Yeah, I would certainly agree. There's just like you said there too. There's something that's just irreplaceable about what you can do meeting and networking with other people, having a chance to meet people from different areas, to exchange ideas and infuse each other with new ideas, thoughts, and things that you're doing. It's just the energy that happens at a conference like that is always a great thing to bring back to your practice, because massage therapists have this challenge of oftentimes spending a great deal of their day kind of alone in the bubble in the treatment room, and this is the kind of thing that gets you out of that and gets you connecting with other people doing the same thing that you're doing, and really getting a chance to infuse it with a great deal of new energy. So that's a wonderful reason for being there and coming to be at this event. And for me, it's also a great time to get to come back here, because Atlanta is my hometown. So it's nice to be able to have this first inaugural conference happening there.
Well, that is really exciting. Hopefully you can give us all a tour of the fun places to go besides the conference, of course.
That's
we know
right.
a lot of fun things will be happening there, and I'll tell everybody about those a little bit later.
Yeah.
But first, I really want to find out about your class. So can you tell me a little bit more about the topic that you're bringing to the American Massage Conference, active engagement techniques?
Yeah, this is a class that's going to focus on a particular treatment strategy called active engagement techniques. This technique goes by several different names, but there are some unique characteristics about this particular approach that we're going to cover in this two-day conference, two-day workshop on active engagement techniques. These are methods that are particularly valuable for working with people who have pain and injury complaints, and especially muscle overuse injuries or chronic tension patterns or things that are not responding to other types of techniques. You know, a lot of the emphasis in working with muscle pain problems puts a great deal of emphasis on deep work, working deeply in those tissues. And there's one way to go deep in the tissues, which is simply putting more pressure and pressing harder on those tissues. But there's another way to get in with very effective pressure to help stretch and elongate the fascial tissues as well as encourage relaxation in the neuromuscular components of a tight muscle, and that is to do specific massage techniques on a muscle while it is engaged in an active contraction process, either a concentric shortening contraction or an eccentric lengthening contraction. And certain techniques are done during the shortening phase and certain techniques are done during the lengthening phase. And I've played with this technique over the years and watched some pretty dramatic results happen with using this with a variety of muscle pain problems that really sped up the healing process for clients. So it's a very important, valuable tool for people to add to their toolbox to be able to use when they're treating pain and injury problems. But not just dealing with those kind of complaints. There's some very other interesting applications of this particular technique that I think are helpful. And that is, like I mentioned, this is one way where you can work on people who have, for example, maybe large or dense muscles, and it feels like a lot of exertion on your part to work on them. Using active engagement methods, it dramatically reduces the effort you as the therapist have to put forth to get very effective results with what you're doing on working with them. So we're going to teach you a lot of places, a lot of areas in the body to focus on these techniques, but more importantly, the concepts and theoretical principles behind active engagement so you can figure out how to then go and do it virtually anywhere else in the body.
Well, that sounds really exciting. And, I was just interviewing someone else earlier today, Matthew Howe, and we were talking about how important it is to work smarter and not harder for therapists. And so it sounds like this same technique, the active engagement techniques that you're talking about, is going to provide therapists with that same sort of opportunity to work smarter and not harder.
It does. And, the other thing that's kind of interesting about this technique, this is one of the things that does, certainly does help you to work with a lot less effort, but it also engages you a great deal. That's one of the reasons the term engagement is so appropriate here, because the client is actively engaged in the process, but the practitioner is also actively engaged in having to think about what they're doing, because you really have to apply your knowledge of anatomy and movement and kinesiology and remember what particular muscles do what particular actions in order to make the techniques work most effectively. And that's something that makes your work a lot more interesting when you're doing this kind of thing with practitioners. So it's something that not only is helpful for you physically, I really think it's helpful for you mentally and gets you much more engaged with what you're doing with your work as well.
Well, it definitely sounds like it. And yesterday, another interview that I was doing, well, I'd like to talk more about this later, but I was talking with James Weslowski, and one of the questions I asked him was, how is your orthopedic massage different than his orthopedic massage technique? And one of his answers was that you're very much the master of teaching people how to analyze and do assessment of the client. And so it sounds like that's part of what you're talking about here when your clients are actively, or rather the therapists are actively processing and going through this, that's a part of the assessment he was telling me about. Is that correct?
Yeah, I would say that's correct, and I expand on that a little bit too here, Felicia, in saying that one of the things that I'd like to make a distinction about is orthopedic massage, unlike many of the other modalities that are out there that we commonly hear about, is not really a technique. it really is much more of a system and a systematic process for looking at different ways to treat pain and injury problems. And as a comprehensive system, it includes, the focus of orthopedic massage is really treating pain and injury problems, regardless of what technique you use, whether that's myofascial work, neuromuscular work, or active engagement techniques, trigger point release. Our focus is using a tool that works for the particular problem that the client has, whatever that tool is. So if you're practicing orthopedic massage, you're not married or attached to any one particular technique. But the key is, in order for you to be successful treating people with pain and injury problems, you have to know and understand what the nature of that complaint is. And that's where the whole assessment and clinical reasoning process comes in. I use the analogy frequently of a carpenter. You can have the best bag of tools in the world, but if you don't know how to use those tools and don't know how to use them appropriately, you're not going to be able to do good craftsmanship. So an excellent craftsman or a sculptor or a painter not only has good tools, but they really know how to use them, and that's also a cognitive process that involves thinking through and clinical decisions and making determinations about how you do what you do and why you do what you do. So those are some of the key facets of what we get into in orthopedic massage. And, there is a great deal bit more thinking processes that have to be engaged by a practitioner who's going to work in that kind of environment because, you're having to make some pretty serious decisions about healthcare problems, and sometimes these can be pretty serious healthcare complaints. So you need to be able to make those good clinical decisions about, is it appropriate for me to be doing this, and what kind of treatment strategies or treatment approaches would be most effective.
I see. So you're talking about a number of different skills that a therapist really needs to have beyond the technical ability of providing a certain technique or modality. What other types of skills and abilities do you think are important for clinical massage therapists to have in order to be successful?
Well, this kind of gets back to what we were saying a moment ago. A lot of our continuing education courses focus a great deal of attention on techniques, and this is, without a doubt, very valuable for us to learn new techniques and new methods. But as a clinical practitioner, you have to have a good understanding of a number of other fields. For example, if you're going to treat pain and injury problems, you have to have a real good understanding of fundamentals of biomechanics and movement, and you have to understand pathology and what happens to different types of tissues when they're injured. What is the most common type of way a muscle is injured? Or what is the most common type of way a ligament is injured? And would the forces that a person's body sustained be sufficient to damage a ligament tissue with this injury, or would it have been a tendon or a muscle or fascial tissue? So we have to apply concepts of biomechanics and pathology and physiology in combination with what we do with our treatment techniques. And, of course, also the assessment and evaluation process is a crucial part of that because that's what drives the treatment. Until you know what you're dealing with, you're not in a position to really choose the most appropriate method to do that. So, as I was saying, a lot of these are sort of clinical decision-making processes that the therapist needs to be well trained in addition to those key, really good, high-quality hands-on skills that we want to train as well.
I find myself in my massage practice, in fact, I was just telling a client this the other day, that I think one of my strengths is that I do really, not even though I don't think I do the same type of work that what you're talking about, I listen and I really ask a lot of questions and help come to find out what is causing the problem, being really specific, rather than just saying, oh, your shoulder hurts, okay, well, I'll just jam my elbow in here and hope I can make the pain go away.
Yeah, that's exactly what we're talking about. It's the difference between sort of a shotgun approach of just, going in and just doing everything that you know to do on somebody's shoulder and just thinking through and really asking and delving into what's going to be best for them, because you can't go and consult a recipe book for, if somebody's got shoulder pain, you do 5 of these and 3 of those and 2 of this ones. It's just not that simple. Each person is unique, and each person's life and their client history and everything about them is unique and different. So you have to tailor your individual treatment for their unique presentations, and that requires thought processes.
It does. I often look at each client as an intricate puzzle. They're the problems and issues that they have, and I'm the one that's trying to figure out how to solve the puzzle.
Yeah.
And it sounds like what you're providing is a lot of great methodology for helping people to solve their own clients' puzzles and pain management issues.
Yeah, that's exactly the key of what we're after, is really giving people some of these kinds of skills so they can know how to pursue that process with each individual client that they're working on in the future. So it's not as simple as just, mimic what I do and do these techniques exactly like I do and everybody will magically get well, because that's not, as much as it would be great if that was the case, that's just not how it works. You have to be what we refer to as the thinking practitioner. You have to be thinking on your feet in the midst of what you're doing. And that makes our work so much more fun, too. I mean, that's what makes it really invigorating and interesting to work with each unique client that way.
I agree with you, and I'm just like I have said with everyone I've interviewed so far, I can't wait to take your class. I wish I could just clone myself and be in every single one of them, because it sounds fascinating.
Yeah.
And I can definitely see how it would benefit my practice. What do you think that the students who sign up for your class are going to find most helpful or valuable when they take that at the conference?
Well, I think there's a couple of things that they'll be coming away with. One is some specific new ways of looking at the body and looking at how to work certain types of muscle groups in certain areas of the body. Take, for example, the forearms and hands, something that doesn't get a great deal of attention in a lot of our massage treatments, or maybe the lower leg region, but an area that's exposed to chronic repetitive overuse problems for many people. And these active engagement techniques are an outstanding way to deal with upper extremity nerve entrapment problems, chronic overuse complaints like tendinosis or other chronic overuse problems in those areas. What they'll come away with is a new appreciation for many different ways that they could go about doing these types of techniques for a variety of different regions of the body.
Excellent, excellent. And, when you're talking about the forearms and hands, in my conversation with James Weslowski, he mentioned that he's also presenting on those areas. I'm wondering, can you explain a little bit of a difference, since you are both presenting on the orthopedic massage, as I mentioned earlier? Can you explain the difference between the way that you teach or your presentations and how they complement each other?
Well, I think this is just a perfectly good example of that, is that there's so many facets of these different complaints to look at. Some of the things that James will be getting into are some very specific areas in focused regions of the body, where he's going to go over a number of different techniques and applications and the relevance to certain types of pain and pathological problems. And we'll be exploring similar concepts, but the 2-day course that I'm doing is a little bit more global in its focus, since we'll be dealing with a lot more different regions of the body. But there's a great deal of both similarity and complementarity in these approaches, in that you're learning new ways. It's like you're acquiring new and different tools and new perspectives and new ways of looking at things that both enhance each other. I think there's a lot of great enhancement of the things that he's doing in class that will help people if they look at the body when they do some of the things that we're doing in this class, and vice versa.
Wonderful. Now, James mentioned also that the two of you are considering creating a master certification in orthopedic massage by combining both of your certifications and trainings. Can you tell me anything about that?
Yeah, this is actually a very exciting thing that we have coming down in front of us here in the next couple of months. And this started several months ago, and I was looking at what was going on in asking the question of what are the ideal skills to train an orthopedic massage practitioner to be the best possible practitioner they could be. And clearly, to me, I think there's a couple things that are needed. They need very good hands-on clinical skills. They need a good presence in the treatment room, and they need a good quality and a good grasp of how to perform good hands-on skills. This is what we were talking about earlier. But they also need a strong foundation in clinical reasoning and these other concepts of biomechanics and pathology and assessment and kinesiology. And for over 15 or so years, I've been teaching these concepts and courses in the weekend workshop continuing education format, and becoming incredibly frustrated with it because I just didn't feel like there was enough time to get to all of it. So a number of years ago, I started doing some online programs that were far more comprehensive with all the clinical reasoning and cognitive activities, the assessment concepts, the treatment plans, the pathology, because we could do that kind of stuff way more in detail in an online training program. And in this program, I'm actively working with each student throughout the entire duration of this 40-hour, or actually 120-hour-long course that's broken up into 3 segments. And so I was thinking, well, what if we could take the best of both worlds, the stuff that James was doing in the classroom that had a lot of great emphasis on technique and clinical skill abilities, and combine that with all these emphasis on clinical reasoning and assessment and pathology, things like that. I was thinking, man, that would be like the best and most ideal type of education for somebody. So I approached him with the idea of wanting to come together and do some of this kind of stuff, and he was very interested in it. And so we're both very excited about what's coming down the pike as we develop this over the next month or so, and we'll probably be launching this very shortly and making it available to people to be able to have a number of different options to get the most ideal education that they can.
Well, I hope that you have something ready to share with everyone when we get to Atlanta.
Oh,
the
yeah.
American Massage Conference, because I know everyone that's there is going to be interested in that.
Yeah.
Certainly everybody that's listening in on this interview is going to be interested, but we hope that we've got some information to share at the conference.
Yes, we will. We'll be, I think, well on our way to. We'll probably have some things already in motion by that time, I think, based on the timeline that we're currently working with. But both of us are kind of thinking the American Massage Conference will be sort of a very good place for the sort of grand launching pad of getting a lot more publicity out about this new initiative.
Most definitely. So, Whitney, we've talked about a lot of different things. I want to make sure that I don't miss anything that you think is important. Is there anything else that you want to share with massage therapists and body workers who are interested in doing orthopedic massage or learning more about it?
Well, I'd say, this is a fascinating aspect of the massage therapy field in treating pain and injury problems, and it's something that we just have a tremendous need for in our society is people who are prepared to fit that bill and to fit that role of the practitioner who can deal with the incredible number of soft tissue pain and injury problems that exist out there in the healthcare system. The other thing I'd want to make a point about, and this is something that I'm pretty adamant about in our field, is I do some work with an organization called the Academic Consortium of Complementary and Alternative Healthcare, which is designed to focus on helping to integrate alternative care in with the traditional mainstream medical care, both in medical schools as well as in medical settings, healthcare settings. And one of the things that we find is a continual problem in our particular CAM profession. There's a number of the complementary and alternative medicine professions, chiropractic, acupuncture, naturopathy. One of the challenges that we have is, as massage therapists, we are very capable of helping a lot of people, but we also have very poor educational standards compared to the other complementary and alternative medicine fields. And so we need to do a lot of things to boost our education and our qualifications to do the kind of work that we're really capable of doing. And that's exactly what can happen at places like right now at the American Massage Conference, where you can have a group of stellar educators coming together to share things with practitioners and people coming to share their experiences with each other. These kind of educational events are a big, important part of us right now, trying to improve the quality of what we're doing with massage education across the country, because we've got a long way that we really need to go to be prepared and taken seriously as a true player in the healthcare arena here.
I agree with you on that. I tell you, it's that's a big journey
It's huge.
to get everything standardized.
Yeah. I mean, there are days when I feel like, pushing a train up a hill, it's that kind of heavy work, but it's got to be done. And the point is, there are so many people out there who need us. And so that's what keeps me going every day, is knowing that there are so many people out there who can benefit from the things that we're doing. And the more I can share with practitioners, the more I can, share everything I know and everything that I've done and learned over the years, the more people they can help. So that's really what keeps me going doing this, is, finding ways to help a greater number of people that way.
Well, it's obvious to me that you're doing a lot to help our profession and to help the practitioners as well as their prospective and current clients in their journey of feeling better and just overall wellness. I know that our listeners are going to want to reach you and find you if they can't make it to the conference for some reason. How can they learn more about you, the type of work that you offer, and the classes that you have available?
Yeah, the best place is on our website from our company, the Orthopedic Massage Education and Research Institute, which you mentioned at the beginning. We just call it OMERI because it's a mouthful. So they can find us on the web at www.omeri.com. That's omeri.com, and that's the best place to find out about all kinds of things that we've got going on, and sign up for our free newsletter every month that gives information on recent research findings and new clinical tips and things like that. And also there's links there to follow us on Facebook and Twitter, some other clinical tips that I put out on a regular basis as well to be helpful for practitioners there. So that's the best place to hook up with us, and we'd love to have everybody join the conversation.
Excellent. Well, I'm sure people will take the time to go to your website and learn more about you and sign up for your newsletter. Mm-hmm. In the meantime, I want to remind people who are interested in taking Whitney Lowe's class at the American Massage Conference. It's not hard to sign up. All you need to do to start out is to go to our website at www.americanmassageconference.com. I'd like to remind everyone what else is going on at the conference, though, besides Whitney's great workshop. First of all, it's an amazing, amazing deal on this inaugural event. It's only a $40 registration fee, and that will get you access to 25 free one-hour CE classes from a variety of wonderful instructors. It will also get you access to the trade show and many, many top massage product and equipment manufacturers. It's definitely someplace that you want to go and visit to get all of your equipment and product needs satisfied. And that also will include a chance to win thousands of dollars in door prizes. Let me tell you, from being at the Canadian Massage Conference, these door prizes are some good stuff. So that $40 admission ticket is well worth the chance to win some of the goodies that are going to be available this year. And, of course, there's a Saturday night gala at the event with food, drinks, and live entertainment. But wait, there's more. In addition to the free classes that are available, there's over 100 hours of continuing education being offered, such as Whitney Lowe's class, among many others. For students, we have a free student day and Smart from the Start presentation, along with a free all-day class with Laura Allen on passing the MBLEX and NCB. That's sponsored by ABMP. And attendance in the class comes with a free copy of her book on the same topic, generously donated by her publisher, Lippincott. Additionally, we'll have the first ever massage therapy job fair. That's a national job fair, mind you. That's going to be on Sunday the 22nd, and as I said, it's national, so you don't have to live in Atlanta to benefit from this. There will be national, state, and local employers there, so anyone coming to the conference can potentially benefit with a new job at the American Massage Conference. And to top it off, the hotel rates are really affordable. It's just $121 a night in the conference hotel. You can have up to 4 people in a room. That rate split 4 ways is really, really manageable. So I think you should definitely sign up, come to the conference, and have a great time with all of us. I know all the presenters are going to. As a reminder to everyone also, the show guide will make up the center spread of Massage Today's May issue. That will go out to over 62,000 massage therapists and be available for free at the show. This is the first nationally circulated conference show guide, and it has some amazing advertising opportunities. So if you are a vendor or an educator who's listening in on the call today and you want to get some great exposure for your products or classes, please contact Sandy Pierce at Massage Today for details on becoming a part of this year's show guide. I hope after today's discussion, everyone listening has a newfound interest in active engagement techniques and in signing up for Whitney Lowe's workshop. If you'd like to find out how to attend the American Massage Conference, that's May 20th through 22nd in Atlanta, Georgia, and meet Whitney, attend some other classes with great presenters at this year's event, please visit our official conference website at www.americanmassageconference.com. We also invite you to stay connected with us on Facebook at www.facebook.com/American Massage Conference. Whitney, thank you again for taking the time to speak with me today and share your information about active engagement techniques and orthopedic massage. We are really looking forward to having you at the American Massage Conference this year.
Well, thanks so much, Felicia. It was great to talk to you as well, and great to hear the excitement that's coming around this conference. I think it's going to be a wonderful event, and I certainly look forward to getting to hook up and meet with as many people down there as possible. So thanks again so much for putting this together for us.
Well, it's my pleasure to be a part of it, and I'm looking forward to meeting you in Atlanta. This is Felicia Brown, and on behalf of everyone at the American Massage Conference and Massage Therapy Radio, I want to thank you for tuning into this broadcast of American Massage Conference pre-conference broadcast series. Please remember to check back for upcoming interviews each week between now and May 20th. We look forward to seeing all of you in Atlanta in May. Thanks again, and have a fabulous day.
Come again.
Let there be plenty. Let there be plenty love. Let there be